Welcome to Field Notes, Insights from New to Public Health Alumni. New to Public Health is a year-long workforce training program for those who are new into the field of public health. I'm Juliana Mansky.
And I'm Mackenzie Legal. We are program facilitators and hosts of this podcast. With a vibrant community of over 400 current and past residents, New to Public Health is a wealth of knowledge and experience in the public health field.
In each episode, we'll share inspiring stories and valuable insights from those who've journeyed into public health, highlighting their unique path and the impact they're making. Joining us today is Michael Jarvis, Director of Public Health Policy from Winnebago County Health Department in Rockford, Illinois. Michael graduated from the New to Public Health Residency Program in December 2023. Michael, thank you so much for being with us today. Tell us more about your role as the director and how your experience in New to Public Health informed the workforce needs and policy organization for Winnebago County.
Certainly. Thanks for having me. So in public health, there's definitely a need to orient professionals that come from other spheres of talent in the world. We definitely tend to, as a field, draw folks from various skill sets. So whether it's, medical field, social services, we tend to, bring a lot of perspectives into this world to help public health. So my experience in public health and private healthcare provided me with a unique chance to take part in the New to Public Health program and evaluate experiences that could support the Winnebago County Health Department's strategic plan, I-Plan, which contains our community health assessment and community health improvement plan, and our quality improvement plans. And as a newly appointed director, that was a kind of a unique chance to partake in. And that experience provided me with the knowledge to be able to kind of evaluate the New to Public Health program to see how that would potentially impact our future leaders here at WCHD and determine if the knowledge they would gain by completing the program would be a benefit and be supportive in our workforce development needs.
Well, supporting the transition and needs of incoming public health professionals is pretty foundational to the success of the workforce as a whole. So thank you for being that person to help evaluate for Winnebago County. How have some of the evaluation skills you mentioned that you maybe learned or enhanced through New to Public Health informed your work?
So two things kind of come to mind for me with that. So in public health, we're always looking towards quality improvements, and an area that WCHD has pursued has been public health accreditation through FAB, or the Public Health Accreditation Board, and using that as one of our guiding tools to support our departmental improvements. I was helping co-lead our reaccreditation process at WCHD as part of our quality improvement goals for the year. And participating with the New to Public Health program paired me with a mentor who had also gone through the reaccreditation process, and having that opportunity to learn from peers and others around the country that had gone through that same process to kind of bounce ideas off of each other, what were best practices that worked in their specific departments or fields, and what we might be able to pull back and utilize here in Winnebago County for the benefit of our residents and community members that we serve here. So, through that was a good area to collaborate with peers in the field. And we kind of identified through our community health assessment that we had our 3 health priorities identified by our community as maternal and child health, violence reduction, and mental behavioral health. And we wanted to try and see what policies we could have put in a departmental level and organization-wide to support those health priorities. And looking at what they were, we kind of discovered that the trauma-informed care approach touched on all 3 of those health priorities identified by our community. And so we worked forward and tried to have that trauma-informed approach kind of baked into our policies. It became our baseline. So that was an area that could touch on those identified health priorities to the benefit of those community members and residents that we serve here in Winnebago County.
Well, that learning from peers and colleagues is definitely a major goal in the New to Public Health Residency Program. And I'm so glad to hear that you were able to both lean into that peer networking and embed some of those potentially new resources into the work that you were doing there. So thank you so much for sharing your experience with us today and shining light on the public health policy work you're doing at Winnebago County.
Thank you for having me. It was a pleasure to be here.
Thank you for listening to Field Notes, Insights from New to Public Health Alumni. For more information, visit new2publichealth.wisc.edu.